longitudinal distraction, okay? It can be directed at the hip joint, okay? This is actually a technique that you can use if a person's having sacroiliac or even like lower lumbar level type pain and dysfunction, because sometimes when you give the thrust, again, it's not going to be localized just to the hip, but I'm going to be creating a shearing effect on the ilium, which is going to create a quick movement, velocity movement over the SI joint, but then also up the lower segments of the lumbar spine. It's definitely possible. This is one you definitely want a high-low table for yourself. Okay. What position do we think the hip should be in when I do the thrust? The long axis thrust? Right, so the open pack position for the hip, right? Hand contacts are just proximal to the malleoli, okay, at the ankle. I can start to get a sense of where is his open pack position, where does it seem to move the most, okay, so I can take, starting to just get an assessment of it. What kind of conditions might this be indicated in? Individuals with what? Huh? OA? Okay, arthritis, hip arthritis, what else? Piriformis syndrome, glute medius minimus tendinopathies, trochanteric bursitis.
Would you do it for impingement?
Hip impingement, yes. I'm thinking one I probably would not is if there's a, I don't know, yes or no, I'm questioning a known labral tear. If they have a known labral tear and then you're imparting this quick movement on where the joint could be inherently unstable. Impingement syndrome, that's happening to them because when they get into that full flex, they're impinging on, so they're not in that position at all. So I might be able to reduce a lot of that muscle guard and intergermin. So those are different conditions, but impairments you might find, individual with low back pain who has a lot of iliacus psoas guarding as part of their impairments. This can be a really good technique to down train those muscles, reduce that guarding. So the person's just on the table, they take a deep breath in, as they let it out, I take up the slack, and at the end they just give the quick thrust, okay? As far as your position, very important, you don't want your feet side by side, you don't want them together. If I'm imparting a force this way, I want my feet in that line of movement, because that's the way I'm going to be shifting my body weight, okay? You don't want to think so much pulling with your arms as much as it's more of a body movement, okay? So one time, just take a nice deep breath in for me, let it out. I can take up the slack, and then just, once it's out, just give it the quick thrust, okay? If I'm really interested in trying to, because I'm really trying to get to the lumbar spine, I might pull a little bit harder, but just be careful, the harder you pull, the more segments and uncontrolled you're going to be. So.
If you, do you want to target the SI joint or the low back, would you put them in the closed pack position for the hip so that it...
No. And in fact, that's probably one of the, you never do a thrust in the closed pack position. Just like you never mobilize a joint in the closed pack position. But you go, even when I try to focus my force on the hip, you're going to have that effect up the chain. It's just going to happen. Okay? In fact, I had thrown out my back one time, and the only thing that worked for me that day, I'd have Brian work. I was one of the two low back lock. I was so guarded, he couldn't even get me in the lumbar roll and some of the other ones. He actually said, let me try this, and he pulled, and boom, it just popped. It was because he was just someplace else, and I was able to relax on the table. And I felt a lot better by the next morning. So that was